Welcome to our YouTube channel. Today we're talking about United States Senator John Fetterman from Pennsylvania and his diagnosis of clinical depression. Senator Fetterman recently left the Walter Reed National Military Medical Center where he spent 6 weeks receiving inpatient treatment for his clinical depression. Now that he's on the road to recovery with his mental health in remission, we're exploring what this diagnosis means for Fetterman and for the entire state of Pennsylvania. Senator Fetterman is no stranger to medical issues, having experienced a life-threatening stroke last May from which he is still recovering from. According to his statement released to the public, Fetterman spent the preceding weeks leading up to his hospitalization experiencing symptoms of depression including low energy and motivation, minimal speech, poor sleep, slowed thinking, slowed movement, feelings of guilt and worthlessness, and more. While there was no suicidal ideation present, his mental health conditions had greatly worsened to the point where he wasn't eating or drinking fluids, leading to very low blood pressure. Ultimately, Fetterman sought medical assistance and was admitted to Walter Reed where he was treated with medication and rigorous therapy. His care team was led by a neuropsychiatrist Dr. David Williamson and successfully treated him to the point where his depression is now in remission. Senator Fetterman is due to return to the Senate when it resumes session in mid-April, and his constituents couldn't be more excited. In his statement, Fetterman was profusely grateful to the doctors, care team, and the hospital for giving him his life back. With the desire to be a great father, husband and senator that Pennsylvania deserves, Fetterman is ready to return and make a difference in the Senate. Depression is a serious condition that can affect anybody and is not to be taken lightly. While we're not sure what caused Fetterman's particular diagnosis, we do know that depression can be effectively treated with the right combination of medication and therapy, allowing those affected to go on living successful and fulfilling lives just like any other person. Keep in mind, it's always important to take care of your mental health, not just during periods of stress, but always, and to speak up if you or someone you know is feeling down. Ultimately, we want to thank Senator Fetterman for taking the courageous step of speaking out about his condition and for showing just how much can be achieved regardless of mental health challenges. At the end of the day, he's a living example of how effective treatment and willpower can still allow somebody to reach the top.